The CAP contributes to new guidance on Ebola. Can you help advocate for pathology this month? And 3 legal issues that pathologists need to prepare for. These stories and more coming up next. This is Path News Network Daily Edition from the College of American Pathologists. I'm Nancy Johnson. It's Friday, August 21st. As the Ebola outbreak in Africa grows, a new resource can help laboratories safely handle specimens from patients with viral hemorrhagic fevers. The guide contains key biosafety considerations to support lab readiness and response efforts. The CAP helped develop the document with the Association of Public Health Laboratories and the American Society for Microbiology. You'll find a link to the guide in the show notes. After the CAP asked for stepped-up outreach to members of Congress while they are on summer recess, members have sent more than 850 action alerts in just the past 2 weeks. We're well on the way to hitting the goal of 1,000 contacts this month. But there are still congressional districts that haven't heard from a CAP member this year. Go to the Action Alerts page at the Advocacy section of the CAP website or contact CAP staff directly to connect with your representatives. Consistent advocacy keeps important issues on lawmakers' radar. Check your inbox for the 2026 Practice Characteristics Survey. The survey helps the CAP track changes in pathology practice, compensation, workforce trends, and emerging issues such as AI. The CAP uses the results to help set advocacy priorities and inform messaging. It takes about 15 minutes to complete, and you'll receive an Amazon or Starbucks gift card as a thank you. Check your inbox for an invitation and submit your responses by August 28th. And finally, recent trends raise new legal issues for pathologists, and an upcoming CAP webinar asks the experts, bulletproofing your practice against medico-legal challenges will help you prepare. It's scheduled for Tuesday, September 15th at 1 p.m. Central Time and will feature 2 lawyers who specialize in these emerging legal issues. We spoke with the moderator, Dr. Cedric Bailey, staff pathologist and assistant professor at Cedars-Sinai Medical Center in Los Angeles and vice chair of the CAP's Practice Management Committee, about the 3 issues they'll cover. The first is patient data, which is increasingly sought by healthcare systems, insurers, researchers, and the government.
If you are generating data, which we all are, it behooves you to understand how that data is accessed, who owns access to it, and who can buy and sell that.
The second topic, why pathology practices need to be ready to immediately switch from electronic laboratory information systems, or LIS, back to paper.
We were talking about cyber attacks that have happened over the last few years to certain people who we know in pathology, and how they had to go back to like handwriting reports, faxing reports, not having an LIS for days, weeks at a time. And that was kind of one of those doomsday scenarios that the people I know who had to go through that wish they were better prepared for.
Topic 3, self-referral. The webinar will explain recent developments in anti-kickback laws and federal government guidance and how to operate within the rules.
This really comes into play in certain types of private practice scenarios where like an outpatient clinic might be generating pathology specimens that they then review in-house.
Dr. Bailey had high praise for the webinar's legal experts, Emily Johnson and Elizabeth Sullivan of the national law firm McDonald Hopkins.
I've listened to them talk, and honestly, every time I come away with more knowledge and a better appreciation for the attorneys that help us in our practices as well.
Register for this important webinar at the education section of the CAP website. That's all for today. See the show notes for more information on today's stories. And if you've got a story to share, write to us at stories@cap.org. We'll be back Monday at 5 a.m. Eastern for another episode of the Daily Edition. I'm Nancy Johnson. Have a great weekend.